It's my honor and privilege to share with you my project entitled Advancing Women's Health in Kenya. My name is Dr. Angela Mule, and by way of introduction, I'm a medical doctor by training, currently working in the pharmaceutical industry, active in the oncology space. I work as a patient journey partner for breast cancer with Roche Kenya Limited. We all know the role that women play in our families, in the societies, in the communities, and even the contribution they make to our economies. Yet, women bear a disproportionate share of the disease burden worldwide. To put this into context, in Kenya, breast and cervical cancer are the leading causes of cancer morbidity and mortality in the country, with very poor outcomes for women. In addition, cultural stigma and inadequate healthcare infrastructure further exacerbate these existing health disparities. The purpose of my project is to address barriers such as access to quality healthcare for women, timely diagnosis, and other healthcare inequities that impact women's health. And the goal of the project is to see improved health outcomes and equity for women in Kenya, because we know that if we take care of a woman's well-being and her health, we have not only empowered that one woman, but we have empowered her family, her community, her society, and we have even contributed to building that economy. The theory of change of my project was to look at existing research and data around women's health, to have stakeholder engagements and engagements with advocacy and policymakers. And the outputs are to come up with research reports, policy drafts, and white papers, as well as advocacy and awareness materials around women's health. What initial milestones have I achieved so far? I've been able to take a deep dive into the existing research around women's health. I've looked at successful investment cases for women's health, whereby funds have been put aside specifically for women's health, resources allocated and ring-fenced for that purpose alone. And these investment cases have even demonstrated a return on investment for investing in women's health. I've been able to identify successful case studies for national women's health programs that have been rolled out, whereby activities have been put in around early screening and diagnosis for women's health. And we've seen through these programs improved outcomes for women's health in these countries. I've been able to have engagements with various stakeholders around understanding funding and financing specifically for women's health in Kenya. The project has not been without challenges. We've seen significant transitional challenges with the social health authority that has been rolled out in Kenya. The oncology packages under this social health authority are not very clear in terms to what the resource allocation for these will look like, whether these resources will be sufficient. We've seen government put in austerity measures that have affected resource allocation for health, amongst other challenges. However, it's not all doom and gloom. There are also opportunities that I've identified, and one that I'm particularly passionate about is establishing a dedicated advocacy platform for women's health that can continue to have these conversations to shed light on the issue of women's health. I'm going to successfully leverage these case studies and the investment cases in other countries as proof points for the need to really invest in women's health and the importance of women, even in terms of improving their outcomes and contribution towards the growth of the economy. This journey for me has been transformational. Looking at leadership through the lens of authenticity, inclusivity, strategic and impactful leadership is something that I will take with me for the rest of my personal and professional journey. I've been able through this project to understand the interconnectedness of various health challenges faced by women and the need for an integrated approach. I realized that I cannot just look at cancer-specific initiatives for women's health, but I need to take a step back and look at the big picture to be able to come up with a broader framework that will incorporate various aspects of women's health. I am committed in the future to continue to explore and build this Kenya Women's Health Network. And here my ask is anyone who has experience building a women's health network or who understands what already exists in our region, I would really be grateful for the connection to be able to bring this vision of advancing women's health in Kenya to life. Thank you very much for your time.